The government will support the government when they do the right thing.
I'm here at the Dixon City Academy in Bradford at the Black Health Forum to find out just what is the state of black health, A, in West Yorkshire and B, nationally. There's some fantastic, exciting speakers.
The aim of today was to identify and prioritise what the health and wellbeing needs are for the community, for our African and Caribbean communities in Bradford, and to develop an agreed Black Health Forum action plan for 2016-2017. And I say an agreed because it's not about us doing it, it's about you working with us to do that.
And you've got to make that happen rather than us working on people saying, well, you need to change your behaviour and you need to do this because you're not accessing our services the way that we designed them. So it's kind of saying, actually, you need to design your service the way people can access them.
With all the cuts that have been going on over the last 5 or 6 years, what is the Bradford Commissioning Clinical Group commitment to the local community, and especially those from the diverse and minority ethnic community?
Well, I think what we've been doing over the past 3 years that we've been in existence is really working together with communities and working with people who live in those communities to understand their experiences of using the health services we have in Bradford, and understanding how we can make the changes and improvements to that, and also building on good things that do happen in health services. So it's really understanding the experiences of people, understanding how they're using services and what barriers that they're experiencing to accessing services. So the commitment that the clinical commissioning groups are making is about how do we work together with communities, how do we empower them, how do we give them the tools and resources to be able to self-care, because those cuts are impacting on health services. We can't afford to deliver health services the way that we always have. So we do have to work together with communities to think about how can we do things differently, how can we do things for the better of health, and how can we think about the future. So we've got to focus on prevention. We have to focus on making more efficiencies, and also we have to focus on closing that inequality that we're seeing in communities.
The state of the black community nationally is in one of crisis. We've got an economic crisis. 55% youth unemployment within the black communities is completely criminal and scandalous. You know, it's a 55% youth unemployment in Greece right now. It's a 50% youth unemployment on the West Bank, Gaza. And it's 50% unemployment in Italy, who's on the verge of an economic crisis. And yet here, in the fourth richest economy in the world, we have a community right in our hearts that's got 55% unemployment. And that economic crisis is causing great hardship across the country and exacerbating racial inequality.
When you look at the rise of racism and Islamophobia across Europe and in the United Kingdom, you should be frightened for your children. Because right now we're entering the most dangerous time. Any time that the European Union nations face economic crisis, they move to the right. And the more the crisis, the more they move.
Diabetes UK, we've worked with them. They know disproportionately diabetes is higher in the Black, African, Caribbean and South Asian. But they still spend less on us. And it's like Carol says, if you're in areas where they think it's insignificant, so what if you're dead? No, not at all. Not at all. So unless we wisen up, wake up, see what's happening, it'll continue to be that way. I don't know what it's like in Bradford, but I know the rates of death in regards to cancer is ridiculous. You know, we're almost going to a funeral every other week.
We have cancer, breast cancer amongst African Caribbean women actually at a younger age to their white counterparts. So all the services are made for 50 and above. And therefore, if a black woman comes along and she's 30, usually has children, she might be the head of the household, etc., there's no services to support her because they're not expecting somebody so young. And therefore, the other services like hair loss, understanding about self-esteem, that's not there. Then you have prostate cancer, 1 in 4 black men as opposed to 1 in 8 for the white man. You know, it affects us at a younger age. And again, the black man's going, he's presenting at his GP with the signs and symptoms, but the GP is not thinking of prostate cancer because he's too young. So then when he does get a diagnosis, the prognosis is worse and he will succumb to it fatally because he's been diagnosed late.
Can you just highlight how important a cultural reference point is when you are working with people of minority ethnic?
Well, if you, for instance, if you were a mental health worker and you've never met a black person before, you might decide that they're talking loudly, in quotes, aggressively. You might see them moving around with their hands together on the street. You might think they're not speaking sense. You might try to engage with them. You wouldn't understand the normal sets of behaviour of somebody of Caribbean descent in terms of their non-verbal communication. And therefore, that's why we get misdiagnosed as being mentally ill. And that's because we don't have enough people with that cultural frame of reference making those medical decisions. But it's also true in terms of police officers. You know, the extent to which they see a group of black boys on the road, it's always a gang. It's never a group of footballers or a choir group going to practice. It's always a gang. And so what you see is that people's lack of cultural references and cultural competence actually lead them to make wrong professional decisions, whether that's in criminal justice or whether it's in policing, or indeed health.
It seems real strange, right, that, 2016, that we're still talking about building with communities. What's the links that the Clinical Commissioning Group have with those communities already? Is it going to be an easy process, or is it much more of the same? Lots of words, but with little action.
It's not an easy process, and the cuts have made it a lot more difficult because communities, the groups, the organisations that used to be there, that we used to have maybe a dialogue with, don't exist anymore. They're disappearing with the cuts. But what the CCG has been doing, that's the Clinical Commissioning Group, have been doing, is looking at how do we build our relationship. So who is in the community and how do we build that dialogue with the people that are there, and how do we support them to have their own platform. So we've built, over the past 3 years, we've created and supported the creation of patient networks. So that's people who are using services coming together to talk about how they're using those services. We've encouraged a people's board to be established, and that's really taking local people who have knowledge of the area, knowledge of the inequalities, who have knowledge of the barriers and the experiences that people are using, and have skills and expertise to really voice those within our service, and we're supporting that financially and committed as an organisation to making that work. And the people that are on that board are people who have real connections to communities and to a range of communities to build our dialogue with them.
What is the health of the African descent community nationally?
Nationally, not good. And it's not good because we as a people need to have behavioural change. We have to understand that we're not back in the Caribbean, and therefore some of the foods that were good for us then, because we were more active, we would cultivate the land, etc., it helped us. So root foods like yam, etc., we could eat plenty of because that was fuel. And you've got to remember again, the food that we ate weren't always good for us because we learnt to season because it was the lesser parts of the animals that we were given as enslaved people. So we've continued to eat those foods. Now, when you come here to a host country and you're taking the same culture and bringing it with you, it doesn't help you because we live a different life. We drive more, we're less active. So therefore, we're going to be more obese because we're eating the same foods but not burning the same amount of calories that we would do in the Caribbean. So our health is just plummeting. Diabetes, our cancers, we've got sickle cell thalassemia attacking us, which we had over in the Caribbean, but it was for a purpose and a reason. It doesn't help us here. So our health is just, it's deteriorating. And we need to educate our young people so that that is not self-perpetuating. Mental health is on the increase.
How important is this initiative for Black health?
This is absolutely vitally important. You know, we've heard that, you know, times are getting hard. We experience it. And, you know, I mean, as Lee Jasper said, you know, we're in a period of austerity. But, I mean, he echoed words that I've always said. You know, for black people, we've always been in austerity, and we've learned a lot of skills over those years. The difficulty is pulling it together and getting people to work together, and you know, and take those skills forward, and stop thinking of themselves as being de-skilled. You know, there are a lot of skills out there because we've learned how to manage on small pots of money, and in some cases nothing at all, and we've still achieved.
I think definitely watch our People's Board, look at how we're developing that, how that's been created. We want to work together with communities, we want to learn from each other and go forward and really, you know, acknowledge that there's a struggle ahead, but that actually together we're stronger to get to a better place.
So what can we do as the African descent community to actually collectively make things better for ourselves?
Be more proactive. I think we have lived in a way where we expect people to help us help ourselves. We now just have to help ourselves. You know, most of us now have been educated here. We have our PhDs, our masters, we have our lived experience. We can now put that into practice. Unfortunately, a couple of generations ago, we didn't have that lived experience in England. So we didn't quite understand about you know, the way things worked. We do now because we've been brought up in it. We can band together, work collaboratively and address the issues.
I think we've got to heavily invest in making sure we have a legacy and succession planning programme for the next generation. I think we've got to give new people the opportunity to learn some of these experiences and skills that we have. I think people of my age group, the Windrush baby generation, have got to get down and start to write books and pass on the detailed knowledge of the dynamic of racism, how it operates, how sophisticated it is, what you've got to look for, what you should do if you're challenged by racism. Where can you get support? You know, we brought our kids up to believe that as long that the fight against racism is largely over, and as long as they do well in school and keep their head down, they'll be fine. And yet we've got thousands of perfectly good kids who did just that, who have never been given an opportunity. So it's up to our generation really to secure the future, and that future is legacy, succession planning, ethical leadership and training for young people.
I think today went extremely well. It's the first time that we have sort of like engaged with people in this way in order to inform our action plan. And we felt that, you know, in order to make the action plan work, we needed the voices of ordinary people. And I think today did exactly that. I think our visiting speakers sort of brought the audience in and brought all people to talk about their experiences. And they in turn, you know, were able to give their life experience, which I think is, you know, what we set out to achieve. Yeah.
Lipsa de motivare pe care foarte mulți angajați.
When they do the right thing.